I think we can get started. So again, hello everyone. Welcome to the DHIS2 and MOSIP integration demo using digital ID across health services. So today's webinar is going to highlight and we are going to talk about a quite complex but innovative topic. And due to the nature of this topic, we have few teams joining for today's presentation. So I guess we can do a quick round of introductions across the presenters because we'll be shifting back and forth between presenters throughout the webinar. So let me first invite the team from MOSIP to kindly introduce yourself.
Hi, thanks, Pramod. Hi, I'm Sanat. I look after MOSIP Academy. I've been with MOSIP for last 5-6 years, and I'm also a software architect by profession. That's about me. Yes, Rachik.
Yeah, thanks, Anath. Yeah, I'm Rachik Raj Sharma. I'm also from Team MOSIP. I work as a product owner for one of the modules, which is eSignet, which you will see is being used in this particular use case later in the webinar. Thank you.
Hello, everyone. I'm Anusha. I work as a technical architect for eSignet. Hello, everyone.
Thank you. Is that all from the MOSIP team? I guess so. Okay. Next, I invite Dr. Ashan Diunugalage from Ministry of Health Sri Lanka to kindly introduce yourself.
Thank you, Mohammed. I'm Dr. Ashan Diunugalage. I'm a consultant in health informatics attached to the health information unit of the Ministry of Health. I'm mainly looking at the public health informatics related systems, especially the DHIS2 case.
Great, thank you. And next, I hand over to the extensibility team at the DHIS2.
Hey, my name is. Sure, yeah. My name is Kai. I'm working as the lead of the extensibility team here at DHIS2. We work on app platform features and interoperability features, as well as kind of supporting integrations. And I helped work on this demo here alongside my colleague Johan, who can take it away.
Yeah, hi everyone. I'm Johan Hore, and I'm also part of the extensibility team. And for this project, I worked on the mapping from DHIS2 to FHIR. Yeah, thank you.
We also have our colleague Claude here, who's an integration engineer as well. Not sure if he's presenting right now, but he's in the call and available for questions.
Right, thank you. And finally, me, I'm Pramod Amarakon, representing both the HISP Center and HISP Sri Lanka. Right, so in today's webinar, we are going to deal with several topics. So first, we will discuss about MOSIP. So there will be an introduction to MOSIP and digital ID. And then we will specifically talk about one country that we targeted our, the use case, which is Sri Lanka. And then we will do a live demo of the integration we have done between DHIS2 and MOSIP. And then we will deep dive about the technical side of the implementations, and then we'll quickly discuss about the next steps. So during the webinar, we highly encourage you to ask questions, but what we advise you to do is to type in your question in the chat in Zoom, as well as use the community of practice thread that you have already been engaging in DHIS2's community of practice, and you can also ask the questions there. So we will take the questions towards the latter part of the webinar once we are done with the presentation, and we will keep engaging throughout, even after the webinar in our community of practice. All right, so with that, we can start our presentation, and I'm handing over to the MOSIP team.
Thanks, Pramod. Good evening and good morning, all. Yeah, we'll be discussing next 10 minutes about the building DPI with MOSIP. This is the key concept. MOSIP as a digital identity platform, how it facilitates building the DPI. Okay, that's the objective. So this background, why digital ID and what are the challenges is what motivated to build MOSIP, right? Because 60 plus countries have attempted to build, but very few has been successful. Why? What are the challenges? That is what we'll see in the next slide here. Right. These are the key challenges faced by nations in implementing identity system. Of course, there are a diverse diverse culture, etc. also adds to the problem. But in addition to that, the available platforms, right? The proprietary solutions, which are inflexible, and then there are siloed approach, where each department will look at its own problems and solutions rather than looking at the problem as the nation as an entirety level, right? Those kind of challenges, the siloed approach is one problem. Another is like, common need but diverse solution. At the end, everybody needs identity, but to uniquely identify the resident, but solutions are different and from different departments using that, and they want interoperable, right? So this kind of challenges are faced by countries in implementing identity system. That is where the MOSIP took birth, right? Next slide, please. Yeah, this is the platform being developed and being incubated at IIIT Bangalore, which is a not-for-profit project for International Institute of Information Technology. Is a Bangalore-based university, which has, of course, several branches, but MOSIP is one of their incubation, which is supported by Bill and Melinda Gates Foundation, NORAD, Pratiksha Trust, and Tata Trust. These are all behind MOSIP, which made MOSIP successful today. Yeah, next slide, please. Yeah. Now, MOSIP vision as a DPI approach, right? Why? Okay, digital ID is an ID which uniquely identifies people. So what? What next? What is the use of the ID? So ID becomes useful only when there are solutions or people are able to use it for their benefit. The residents who should get benefit, right? It is not for penalizing them, right? It's for giving them benefits. That's where MOSIP got into multiple gambits of solutions, like OpenG2P is now part of MOSIP product roadmap, which is basically brings financial inclusion, social benefits, emergency response, then various registries. And this can also get into private sector, not necessarily as a TPG, right? Then INGI and eSignet, which are the key solutions which will be discussed today after my presentation, which allows the credential management, right, to various solutions, which is a digital exchange, digital trust. Of course, MOSIP will talk about that is basically providing digital trust to the other platforms, right? And user consent, that is one of the challenges of privacy, where data of a resident being shared with other applications with educated consent, right? That is a challenge MOSIP and INGI addresses. Then mobility, of course, because INGI is a mobile-based solution, so it the inclusivity is increased, right? And privacy and security are key challenges of any DPG, which INGI and eSignet solves. And at the core, as the foundation, is a MOSIP, which is the providing the trust infrastructure to every DPG solution built around the identity. That is how MOSIP is conceived, right? Yeah, next slide, please. Yeah, MOSIP has been driving the ID systems for last 7 years. We have implemented in 29 countries with 185 plus million IDs already generated, right? Of course, this is from the partners and our countries who are acting as our partners, right? They are the partners to us. Next slide, please. All right, this is the distribution, right? If you see the color code, we have national rollouts, which are in the first color code, then completed pilots. Of course, that is the approach we usually adopt. We go to country, roll out a pilot first with few thousand IDs generated first, and showcase the solution, and then go for the national rollout. That is the approach being followed. So then ongoing pilots and pilots to begin. If you see, there are 4 color codes. So if you see, we have countries with what to say, 126 million to lowest like some 10 million, 20 million population. So we have addressing both ends. Of course, not to the size what Indian Aadhaar has addressed. Of course, 150 billion, you will not have another 150 billion. But yes, but we are in few hundred millions. We are able to address our platform is able to handle IDs of 150 million, 120 million kind of population. Yes, but that is if you see that distribution. And if you notice, it is not all are not foundational ID. We have also rolled out solution on top of other IDs like eSignet adoption. If you see Zambia, or I think, yeah, there is a Peru or somewhere. Yes, there is the LATAM also not all are IDs. There some of them are rolling on top of existing IDs or eSignet and NG solutions. So NG and eSignet can run both with MOSIP as well as on top of other platforms. So, but this is the kind of distribution where even though we have just rolled out 185 plus million residents, but if you see total reach for us is 970 million, because we are in 29 active country engagements. So if we fulfill that, we should reach 970 million. That will be a good number for us. Yeah, this is our plan, and this is how MOSIP is envisaged. Yeah, thanks. Next slide, please. Yeah, of course, the key challenge, as I told, ID is just a it's a trusted infrastructure, but it has to be extended to solutions. So that is where we have envisaged NG and eSignet. Can you go to next slide, please? So MOSIP as ID platform, it was a core responsibility was ID platform, where, okay, first is the registration or enrollment. People enrolled, we got the ID. And next is, of course, verification, authentication, and KYC or credentials. So verification, yes, identifying a user who claims I am so-and-so, I claim I'm Sanat, yes, he is Sanat, right? That is the verification. And for that, they need to authenticate. Typically, we use biometric-based authentication for a higher level of assurance, but lower level assurances, it could use OTP or just demographic data or password-based authentication, etc. Based on the assurance level required, authentication could be different. And then comes, of course, credential, as like you want to open a bank account, you want his date of birth, his address, everything, right? Those credential sharing. So these are the key use cases of ID. That's how it is. Trust is extended when a bank wants to open an account. If the ID platform is giving the credential, bank trusts it, right? The extension of trust to the solutions. That's the key use case of MOSIP, right? As an ID system. So based on the feedback, we got into extension of ID verifications, right? Right now we have online API. We have our own proprietary APIs, which are authentication APIs, which are online. Okay. Then we extended it by supporting eSignet, which is a OpenID Connect based interface. I assume that is being used now for all the relying party integrations. Then we extended also through NG where it could be online, offline, decentralized with biometric authentication using a selfie-based, mobile-based, selfie-based, and third-party verifications. All this gamut of features are provided through our NG stack, which is a credential stack, which can loosely couple with MOSIP, or it can couple with any ID provider and build on top of that. Same thing with eSignet, which can run top of any ID provider, but it's an online feature, whereas NG can be both online and offline. There's possible to use it in both ways. So these are the key verification mechanisms supported by MOSIP. Next slide, please. Yeah, but as I told earlier, ID by itself has no major role to play, but that is where its power comes into play when it is used with other applications. It could be for financial inclusion, social registries, healthcare delivery, benefits delivery, departmental IDs, civil registries. I mean, these are just few we thought, but there could be a lot more, right? There are a lot more, like I think COVID time, the certifications, vaccination certifications were rolled out with ID to check whether it has covered all the people, right? So there are many such use cases possible, but keep in mind, just implementing ID for a country itself is not enough. It has to envisage the use cases around. I think that's about ID. Next is about eSignet and NG. I think Rachik can take over from me.
Yeah. Thanks, Anath. Thanks for setting up the context and giving an overview for MOSIP. Pramod, can we move to next slide? Okay, so as Sanath has already given a very high level overview of how ID is getting put to use with solutions like eSignet and NG, I'll quickly give you an overview of eSignet and then NG and tell you how this is working. So coming first to eSignet, so what is eSignet? So eSignet is simply a very powerful tool for ID verification and authentication. So let's understand this with an example. Let's say I, as a citizen, want to go to a service portal. A service portal in this case could be a banking portal, an insurance portal, or a pension portal. The first thing that I'll be asked to do there is to prove my identity. So if the service portal, let's say, is in this case is using eSignet, so what will happen is eSignet on the front will be plugged into the service portal. User will get the option to let's say sign in with eSignet. Now, once user clicks on sign in with eSignet, the control is given to eSignet. Now, what eSignet is doing in the backend is eSignet is plugged into the ID system. Let's take example that we are using National ID system or MOSIP ID. So when user clicks on eSignet, eSignet asks for the MOSIP ID. eSignet takes that MOSIP ID, asks user to authenticate with any of the authentication factors that are available, which could be OTP, biometrics. It takes that data, and since eSignet is plugged into the ID system, it talks to the ID system and does the ID verification and authenticates the individual before allowing individual to land on to log into the service portal. So what eSignet is doing, it is facilitating the process of ID verification. Okay, so this is a very simple example where you can imagine how eSignet is working by interacting with the service portal on the front and then the ID system on the back. Now, some key features are listed here. I'll just talk, briefly about them. So first is login with trusted ID. So in the example, as I said, I took an example of national ID, but it's not limited to that. eSignet can actually be used with any trusted ID system. Okay, so as per the use case, as per the requirement, you can choose where to plug eSignet into. Then it supports multiple authentication factors. Like as I was saying, you can use OTP, you can use biometrics. There's also an existing integration that we have with NG, which is nothing but a digital wallet where you can use your VC to verify yourself and authenticate yourself. You can include new authentication factors. Then, as I was saying, easy integration with the relying parties, which means that it can easily plug into any ID system, as well as it can easily be integrated with any service portal or any relying party. It's the same thing. So as I was saying, it can be a banking portal, it can pension portal, or insurance portal, any service portal which wants to have the user identify themselves. eSignet can be integrated there. It's flexible by design in that way. Then the collection of user consent, Sanath already highlighted this part. So what we mean by what we mean here by user consent is, once the authentication is completed, before allowing the user to go to the service portal, the user is shown a consent screen where user is asked to choose which user data or which PII data they want to share with the service portal. So there is a list of the data that user sees. It could be your name, your photo, your DOB, your gender, and then user is given the option to choose what they want to share and what they do not want to share. So it's privacy driven in that context. And there is also a concept of essential and voluntary claims, where if relying party definitely wants a user to share some data, then that choice will not be with the user. But for voluntary claims, it's possible to configure and ask user what they want to share. Then avoiding unwanted profiling. That means, in very simple terms, if a user is using, let's say, a service portal A and service portal B, with eSignet, there will be no profiling of the user. Service portal B will never get to know that user is also using service portal A. Then providing multiple assurance levels. This ties back to the second point, which is support for multiple authentication factors. So a very simple example is, if you want to enforce for a high risk scenario that user always gives their biometrics, because we want higher assurance and we consider that biometric is the highest assurance authentication that we can get in. So you can enforce the user to use their biometrics and have this high level of assurance for authentication. Then integration with digital wallets. As I was saying, we already have an integration with one of the wallets that we have, which is ING, but it is possible to actually integrate eSignet with other wallets as well. So what you will see is, on the authentication screen where you are asked to choose the authentication factor, you can configure it to show that you can log in with a particular wallet. Then the last thing is unified sign up. This is another module which has evolved within eSignet, which is basically focuses on, if you do not have a pre-existing ID and you want to create an ID on the go, you can actually use this sign up module to ask the user to register first and then start using that ID. Sign up has much more than that. We have introduced identity verification flow as well as a part of sign up, where you are asked to do a KYC when you are registering yourself. So it has evolved into much more than just being a sign-up service, but it sits within it's another module within eSignet. One more point that makes eSignet very interoperable and very flexible is that it is based on standards. So mainly it is based on OIDC standard for auth flow. We also have a SBI integrate. We also have our SBI where you can actually use your biometrics to authenticate yourself. And we have also started supporting identity assurance, which is another spec which is used for this identity verification, online video verification during sign up. So you can ask the user to open their device camera and check the liveness, check the face, check the documents. So all that framework is now being incorporated into sign up with the help of this identity assurance. So this is a very high level overview of eSignet. Pramod, next slide, please. Yeah, now coming to ING. So ING is a Korean term and it means knowing or recognizing someone. So what ING does is, ING goes one step ahead, and ING allows you to do the online as well as offline verification. So for the areas where there is no connectivity and it is not possible for people to, let's say, connect online and verify themselves, ING gives you a facilitate that process, and it can work offline as well. How ING does it? ING does it by leveraging the concept of verifiable credentials, which in short we call as VCs. So, and what are VCs? VCs are nothing but cryptographically signed secure data that get condensed into a QR code and assigned to a user. It is binded to the user. So what ING is doing overall is, it's a whole set of solution where it's a full set of solution, I should say, where ING is allowing you to issue a VC. It is allowing you to store and manage a VC, and it is also allowing you to verify that VC to identify that particular individual. Okay, and it can work, in offline scenarios, as I said, as well. So next slide, please, Pramod. I'll just walk through the different modules. So as I was saying, it's a full set of solutions. So here you can see there are three modules that we have within NG. First is NG Certify. So this is the first step where you are assigning or you are issuing VC to a particular user. So any authority who wants to issue a verifiable credential to the user, they can use NG Certify. Now, once the VC is binded to the user and issued to the user, now user can use NG wallet. Now, NG wallet can be, operated over a mobile, a smartphone. So if you are a smartphone user, there is a dedicated NG mobile app that you can download and use it to store your credentials. Or if you are not a smartphone user, there is also a possibility of going to the browser and using NG web wallet. So NG wallet overall is allowing the user to download, manage, store, and share whenever required this particular verifiable credential. So it's a way to manage your verifiable credential both on mobile and on the web. And now comes the third part, which is for any service provider. So now I have issued the VC using NG Certify. Now user has downloaded it in their wallet and they are carrying it with themselves. Now when they want to verify themselves using that particular VC, this is where NG Verify module comes in, where a service provider can use this particular module of NG and use that QR code which was issued to the user to verify their identity. So that QR code has all the details, and NG Verify you can simply scan that QR code, get the details, and all of this can be done offline. So there is no need to be connected online. So that's the highlight of using NG and how it actually gives the complete cycle of issuing, storing, and verifying. And again, it's standards driven. It's based on open standards, and it's very easy to adopt it, use it, integrate it as per your use case. Next slide, please. Now I'll come back to the slide, as ID is only as powerful on what it can enable. So we have talked about MOSIP by creating a credential. Then we talked about eSignet NG, which are actually facilitating this process of enabling the ID. So to get any benefit delivery, to get any service delivery, you have to put that ID to use. And how do you do that? You do that by using eSignet and NG. So solutions like eSignet and NG are actually allowing you to use your ID or put your ID to use. And it's spread across multiple cases. Some of them are listed here, but the scenarios are limitless, like financial inclusion, social registries, benefit delivery, civil registries. We recently did an integration with the civil registry where you can create the ID of the child at the time of birth itself, and it also uses eSignet to verify the parent. So the use cases are limitless, and it can be applied as and when it is required. So whether you want to use eSignet, whether you want to use NG, it all depends on what use case you want to solve. One main point I want to highlight here is the healthcare delivery. So the main focus of the webinar is to show, and then DHIS2 team will talk about it, to show how digital ID can be used for healthcare service delivery, and how you can use eSignet in the healthcare domain to verify the patient or the citizen. So I'll hand it over to Pramod and DHIS2 team to talk further about this particular healthcare scenario or use case. Thank you.
Right. Thank you very much, MOSIP team. So by now, I think you must be familiar on what MOSIP does and also about the IIIT Bangalore. Just like in DHIS2, we have the DHIS2 and the entity governing the DHIS2 and coordinating the development is the University of Oslo. So similarly, like we have IIIT-B and MOSIP connected. So how we started this collaboration between DHIS2 and MOSIP? This all started, of course, like we have been communicating and working together for many years. We have been attending each other's events, conferences, for example. But this formal work started last year with support from NORAD, where we started a collaboration from mid-2025 onwards. And in that collaboration, we were kind of focusing on a couple of different areas. Of course, one main one is the technology level integration between MOSIP and DHIS2. But in addition, being two academic institutes, we discuss about research initiatives, and to be playing a major role in DPG collaborative amongst other digital public goods, and also to see how best we can utilize HISP network for promoting these digital public goods, including MOSIP. So here in this particular webinar, we'll be mainly focusing about the technology level integration. All right. So when we discuss about the integration between DHIS2 and any other technology, what the approach that we generally follow is our HISP approach. So what is HISP approach? So it is based on a couple of different principles. So the main thing is about the sustainability of the solutions, and to make sure that these solutions and the technology can be sustained with the existing capacity in the country. So if the country doesn't have the capacity, building the capacity is also part and parcel of this integration process. And our philosophy is promoting open source. So with that, integrating with MOSIP aligns very well. And while we were doing that, we also tried to make sure that we aligned best with the healthcare context that we have in the country. So this is where the digital health blueprint, the standards, and the practices related to sustainability comes into play. Right. So when we try to do this kind of integrations and following the HISP methods, we always try to kind of learn from the country context that we are going to implement. So we then had the main challenge of kind of figuring out what would be the best context that we will first target to learn more about these kind of implementations. We had few options, and one main country we focused for our initial pilot was Sri Lanka. So why we selected Sri Lanka? There are many reasons. One main thing is about the mature health system, and the country already has strong governance and support for the digital health implementations within the health sector. And then there is strong HISP present in the country, and already the country has adopted digital health blueprint. So there are some standards which are already in place. However, when we selected a country like Sri Lanka, we also had some challenges. One is, when the country is already adopting a digital health blueprint, the integration we are trying to do has to align very well with the existing country digital health blueprint. And also the country already had already functioning DHIS2 implementation. So meaning what we try to implement has to align well and work very well with the existing implementations. And then they had multiple layers as well as multiple systems that requires interoperability and multiple use cases as well. So that way, figuring out the ideal use cases was always a challenge. And we always like these kind of challenges when we do something very generic, because when we do something on DHIS2, we have to make sure that it works across the 100+ countries who are using DHIS2 already. Right. So with that, let me ask from one expert from Sri Lanka. So Dr. Ashan, now, could you please explain what is this, very briefly, what is this digital health blueprint in Sri Lanka, and why it was a concern when we were kind of trying to implement DHIS2 and MOSIP integration, especially targeting the Digital Experience Center by the Ministry of Digital Economy. But still, like when we selected a use case from health sector, why this blueprint and the existing practices around the blueprint became very important. Dr. Ashan?
Yeah, thank you very much, Pramod. Hope you all can hear me. As you all know, the digital health blueprint is a strategic framework. So this Sri Lanka digital health blueprint was the strategic framework developed by Ministry of Health Information Unit a few years back, around 2023 actually. So as you can see, it is providing guidance to the system development and integrations and governance of the health information systems. So where all your systems are going to fix, what are the services you need, likewise, actually provide a clear picture. So anyone can easily identify what will be the national vision of digital health solutions going to be, and the standards needed, the architecture, what is going to be, and the implementation wise, what are the things next in the roadmap, and all those things actually describing this digital health blueprint. So when we talk about the MOSIP and the DHIS2 here, there are a few concerns actually. One thing is we are going to use the MOSIP-based ID as our fundamental IDs, so that how we are going to use that in the health sector, aligned with this our National Digital Health Blueprint is the one point we are concerned with. Other thing is actually Sri Lanka already have existing health information systems in the hospital setup and the preventive health sector too. So our plan is to link all these systems to digital health data exchange. So not the one-to-one the connection. So they are actually we have already developed the FHIR profiles and all. So those technologies. So we just do not need the simple integration. So we are planning to have the holistic system integrations of these systems. Therefore, how we can link these systems, the MOSIP and DHIS2 based systems and the hospital information systems, everything aligned with our digital health blueprint is one of our major concerns. Thank you.
Right. Thank you very much, Dr. Ashan. So with that description, what it meant for us is we can't create a simple DHIS2 and MOSIP integration, but we had to align with the digital health blueprint. So let's see how we selected the use case, what was the use case, and how we managed to bring in these different components that MOSIP team explained, like at least mainly in this particular use case, the eSignet component, how we were able to use it for the Sri Lanka use case. So the use case that we selected was the antenatal care use case, which I think most of you joining this webinar today must be very familiar. So let me quickly go through the use case real fast so that my colleague Kai will explain a bit more and do a demo on this. Right. First of all, the health worker has to log into DHIS2, right? So right now, in most countries, we use username and password. So one thing that we can use MOSIP is in this case, like if everyone, including health worker, is having a digital ID, we can use that ID, the MOSIP integration or eSignet component for the health worker to log into the DHIS2 instance. So that's one use case. And then secondly, once the pregnant mother visits the antenatal care clinic, and DHIS2 is the digital platform that captures the antenatal care visit related records, the pregnant mother has to provide consent for that data related to that pregnancy to be captured into the DHIS2. So for that one, again, we are using MOSIP, so that the pregnant mother needs to provide the proper authorization for some related data, like the demographic data, to be imported into DHIS2 from MOSIP, the digital ID system. And then in addition, whatever the other information can be captured on DHIS2 capture app by the healthcare staff. In addition, the other main component that Dr. Ashan mentioned is that this data cannot just be kept in DHIS2. It has to be pushed to the central FHIR repository. In the Sri Lanka use case, it's the National Electronic Health Registry. So once you push that data, I will explain it a bit later how that data can be used by other systems. In addition, there will be multiple other antenatal care follow-ups that happens in which the DHIS2 still captures data, which again is pushed to the FHIR server. And now that we have this data in the FHIR server, when, for example, the pregnant mother visits the obstetrician for a booking visit, for a scan or any other follow-up, that obstetrician is able to access information related to her antenatal care follow-up in the electronic medical record system, whatever that system may be, because there is already an integration between that FHIR server and that EMR or EHR system, and the data is pushed from DHIS2 to that particular EHR system. In addition, as a citizen, the pregnant mother is always able to access view-only details of her pregnancy follow-up using the citizen portal. So here also, in all these components, different tools related to MOSIP can be of use. So that's at very high level the use case that we have in Sri Lanka. So with this, let me hand over. Okay, before that, in addition to MOSIP, we are also exploring right now use of one other digital public good called OpenFN. So more about this integration in a future webinar. So with that, let me hand over to Kai. You want to share your screen, Kai?
Yeah, I can take over from there.
Yes, please.
Let's see. Hello. Desktop here. How's that look? Is that visible?
Yes, it is.
Excellent. Yeah. So thanks, Palma,
Maybe
for
you can
showing
put it
the
on
use
full
case.
screen.
Definitely. visible?
Yes.
Great. So thanks, Palmwood, for showing the background of the use case that we went to show a demo of an integration for. What he described with the DHIS2 instance that uses eSignet to log in. In this architecture diagram of the things that we set up here, we have DHIS2 components in blue on the left side here. The FHIR server for the NEHR, the National eHealth Registry, where all of the kind of health information is synced to in the FHIR format is in red here. There are the patient and clinician portals in green here, and they talk to the eSignet eSignet service here, talking to the MOSIP ID service in the background. And so this is what the like architecture looks like of all these components. But now I get the pleasure of showing what that looks like tangibly, and hopefully putting some images to a lot of the ideas and words that people have presented so far. And so what this looks like for this use case, starting in DHIS2, we've added an integration at the login step where you can use eSignet to log into the DHIS2 instance. And so as we go here, this is part of, because eSignet uses the standardized OIDC flow for authentication, then DHIS2 is already mostly set up for doing this, where we can use eSignet to, here I can use a one-time password to authenticate myself as a DHIS2 user and eSignet, and then eSignet will return that success back to DHIS2 and say this person is allowed to log in. And then here we are in DHIS2. So here we are in the Capture app now. After logging in, we are at the case where we want to register a new pregnant mother in the ANC program. So we go to here, and then in this capture form, we have this step where we can verify a patient. And this button here will also use eSignet to verify the patient's identity and capture or return some of their information to DHIS2 from the ID system. And so I'll just quickly take a detour to use a new ID for a person that I have set up. We can see that when we use eSignet, we have a couple options for how we want to authenticate in the service here. We can use the one-time password or biometrics or the NG app that Rachik was talking about. For now, I'll use the one-time password, use the ID of this new person, have that sent to my email, and we'll verify. And then with eSignet, we'll get to the step where we choose what information from the ID system we authorize to grant to DHIS2. So we can see here that DHIS2 is requesting these claims as required, birth date, address, etc. And then there are some voluntary claims that we can choose. For the purposes of this integration, the person's national ID number is included in the form here in the Capture app, but it's optional, and you can choose to share that with DHIS2 or not. If you don't share it with DHIS2, there are other identifiers that can be used, including identifiers for eSignet and the PHN that you can see in the form here. But we'll allow these things to be shared with DHIS2, and then this form is filled with that information from the person. So we have a new patient. We'll generate a new personal health number. This is part of the digital health blueprint to identify a person across the health domain without necessarily needing their national ID, in case that's sensitive. And then we can save that person. Behind the scenes, that gets synchronized to the National eHealth Registry. And so this person is already saved in that information store there. I can go ahead and fill in just a little bit of information about this person. No, yes, yes, no. Check a couple boxes, complete. And then we have this person saved. They've been verified with their using eSignet, and their information is now stored behind the scenes in that shared eHealth registry. And so the benefit of that is that, as Pamod showed in the diagram here, at a different service, this patient can go and look up their own information. So we go to this portal where the patient can log in themselves. So they have the option to log in. We can sign in with national ID again using eSignet. And by being able to kind of share this information across different health services, you get this kind of continuity of data and improved kind of service delivery. So we're going through the same flows that we've seen. And this portal here, the patient portal and the clinician portal that I'll show shortly after, are developed by a partner organization, Symbionix. We'll share all the information in this case. And now we can see that this person has arrived and is saved in, oh wait, did I save it? Yeah. Yeah, so they're saved in the system and we can see the information from their events here. Likewise, we can go to a clinician portal where we can kind of search that same registry as this patient goes to maybe be referred to an OBGYN specialist at a different facility. That other provider can open up their app, like this EMR here, and search for a person and find them in the eHealth registry and find this new person that we've registered. So that's a little overview of what this looks like to kind of combine this ID provider service with DHIS2 and other health services in the domain. And after that, I'll just quickly talk about the kind of technical side of how we did that. If we go to here, the two main components on the DHIS2 side are we have this login step, and we were able to take advantage of already kind of built-in OIDC flow that DHIS2 supports. And basically, we're able to kind of configure just these variables in the DHIS2 configuration like this with the right kind of client information, the URLs for the OIDC flow, some of the key information, which is obscured here, and some of how we want the button to look. And so we made a few tweaks in DHIS2 to support this, to make it more generic to support eSignet. But that's something that we'll solidify and kind of publish following this. And the other step is this patient verification as part of the Capture app. So we were able to take advantage of Capture plugin, so a micro front end, so we can introduce this OIDC flow, shown with all the arrows in this diagram on the right here, without having to rewrite the Capture app. And we can build this in a kind of generic way that can be shared. And so part of this diagram is the eSignet Capture plugin here that renders this button and does this kind of front-end page handoff with the pop-up. That talks to an authentication service for eSignet, which talks to the eSignet backend through a route in DHIS2, so that we can have a kind of secure back-channel communication from the front end to the back end. Or we can communicate from the front end to the back end, and then the back end can do the secure back-channel communication. So that's how we accomplish this thing. I will hand it over to Yuan to talk a little bit about the approach to FHIR mapping and making this shared eHealth registry. Let's see, I can just share this slide for you if you want.
Yeah, thanks. So yeah, I'll just briefly explain how we move the data from DHIS2 and into the NEHR conformant FHIR server. So as Kai showed in the demo, the data capture happens in DHIS2 itself, but the NEHR is the shared system that the other services rely on. And by other services, I mean the patient portal and the clinician portal as well. So what we did for the demo is to use Happy FHIR server to store and expose the FHIR data. And this server conforms to the Sri Lanka NEHR implementation guide. And this means that it is linked to the digital health blueprint that Dr. Ashan mentioned earlier as well. So the server itself enforces the national FHIR profiles, like you have the Sri Lanka patient, you have the Sri Lanka encounter, So when we are doing this mapping, we are not just sending generic FHIR. We are actually sending FHIR that follows the national rules or guidelines. So we ensure that all of the systems speak the same like structured FHIR language and follows the national standardization as well. And as you can see here in the diagram, the first step to achieve this is to listen to the changes in the DHIS2 database itself for tracked entities. So when a tracked entity is created or updated, the database notifies the agent, and then the agent receives the ID and uses it to fetch the full data from the DHIS2 web API. And it's this payload that acts as the source of truth for the transformation itself. So next step is the transformation. So in a simple terms, it is just a JSON to JSON transformation using data sonnet. So this mapping layer converts like the tracked entity attributes to FHIR patient data elements, completed ANC visits to encounters and all of the data elements, and clinical values in DHIS2 to FHIR observations. And then all of these resources are linked back to the same patient. And as I mentioned earlier, they conform to the Sri Lanka NEHR profiles as well. So this allows for validation, both on the FHIR sync agent level, but also on the FHIR server level as well. And the server can even be configured to reject the data that does not follow the national profiles, which is great. So what all of this does is to enable a more standards-based integration. And finally, when all of the mappings are done and all of the FHIR profiles are then added to a bundle, this is pushed to the Happy FHIR server. And what we do is to observe the data. So if the patient already exists, identified by the PHN or other identifiers, it is updated rather than duplicated. And from that point on, the patient and clinician as well can read from the NEHR conformance server and find their information there, not from DHIS2 directly. So yeah, I think that's all that I had time for. So if you're interested in like a deeper technical details, I recommend you to read the blog post that we have in this. And in addition, you can explore the demo on GitHub as well. So yeah, thank you. I'll hand it back to Kai and Pamod.
Right. So it's about what next, Kai? Next, please. So the thing is, now you have seen a basic technology level integration between DHIS2 and MOSIP. So what is next? We already are planning to implement this, the integration we have created in the Digital Experience Center in Sri Lanka. And we are currently also working with the MOSIP team to incorporate this implementation, at least at a very basic level, in the Experience Center they have at IIIT Bangalore. Next please, Kai. And in addition, now that we have tried this or tested this out in one country, we want to see like more other countries, maybe a country with a mature MOSIP implementation, for example. We want to try this out and see how it works so that we can learn new things and to incorporate them into this generic integration. Next. And then, as MOSIP team explained, there's very much potential for using INGI with the same use cases plus many other DHIS2 use cases. So, for example, even here, during the antenatal care follow-up, the pregnant mothers receives vaccination. So that could be one point where we can use verifiable credentials. But of course, you all are familiar that there are many health use cases where we can use verifiable credentials based on our learnings, especially during the pandemic. Next, please. In addition, we want to also explore how best we can use our HISP network and our other implementing partners for DHIS2 to see how best we can have similar use cases and integrations in the countries who are already using DHIS2. Over to you, Kai, to discuss the rest.
Yeah, great. And there's a couple like technical things on the DHIS2 side that is a wish list that we have for things to kind of make support for DHIS2 and MOSIP integrations more generic. So there's things like expanding our OIDC login for DHIS2 users, making more generic components in that architecture, like the capture plugin and the backend authentication, auth service. Those ones there. Expanding our kind of routes features to map data as it goes in and out of DHIS2. And ideally, if we can make event hook systems for individual level data, then that can potentially replace the need for the synchronization service. And I think that wraps it up for our technical wish list. We'd love to kind of work with partners to continue and expand this work. And I think that brings us to an opportunity for people to ask, and just documentation about how to do this and support for the real implementations that start to happen. Yeah. That brings us to an opportunity for questions if anyone has them. Or other final words from Pamud?
Yeah, no, thank you so much to all the presenters. I've noticed that we are actually on time. And thank you so much, Chris from MOSIP team, to being so interactive in the chat. And I'm also noting at least one question in the chat. So there's a question from Mithilesh. Kai, do you think we have time to quickly give an answer to that question?
Yeah, I hope so. I can stay.
Yeah, so the question goes as, I think this looks like Azure configuration in DHIS2 config file. So is it something that we can quickly answer now?
Yeah, let's see. Is that the full question?
Yeah, so it's a question from...
I can't see the chat.
Oh, okay. So yeah, that's the question. But I think Mithilesh, I think this should be Mithilesh from HISP India, I guess. So probably we can also follow this up in COP or offline. But if you can, or if any team member from extensibility team can answer, that would be great.
Oh yeah, I can give a quick answer, which is yes, the OIDC login for DHIS2 already supports a couple specific providers, including Google, Azure, Okta, and I believe a Norwegian one that has been put into place. It has some support for basically a generic OIDC provider, but not all support for all of them. For example, for the generic provider, to work with eSignet, we needed to enable signed JWT as the authentication method. Oh, for two-factor authentication. Okay, yeah, but there's a lot of similarities here. Yeah, happy to share some links to those features there.
Yeah, great.
Over. Yeah.
So thank you so much. All right, so please keep asking questions in COP, and we will try to get even MOSIP team engaged to answer your question. So with that, we come to the end of today's webinar. First of all, I must thank all the presenters for their valuable time and insights for this presentation. And I must also thank, as always, our comms team for hosting this webinar and just following up with us throughout the preparatory period. Yes, so that's it from us today. So have a nice rest of the day and rest of the week. Keep engaging with us on COP. For now, it's a bye from us.
Yeah, thanks, everyone. Thank you. Thank you.
Thank you, everyone.